Thank you, God. But I will tell you, you need to do something, because this is going to break me. And if it continues at the rate that you're talking about, I don't really know what we're going to do for insurance. But thank you for your time, your concern, your prompt response from your office. It's been great. I'm very proud of you as my congressman. Go to work hard, get this thing done, and let's find a good, moderate, reasonable bill that we can all afford.
But I was going to thank you for your comments and questions even before you were complimentary. But thank you for your compliments for our staff. They do work hard and they care. Thank you for sharing your family story with us. It is not easy to do in a public setting, but I think it's an important part of this public dialogue on health care. I have a lot of questions that I still have to answer before I decide to vote yes or no on the bill that's getting before the House. Are the savings real? The public option versus co-ops. A lot of questions. But there's one thing that I do support, and I strongly support it. I think we have to have insurance reform. Now, there's some in the Congress who like to wipe out the private health insurance industry and get them out of the health care picture altogether. I don't want to do that. What I'd like to do is set the rules of the game where they're more fair to families such as yourself, and particularly to small businesses that aren't being treated fairly in many cases, and see that we bring in more competition into the insurance industry, and competition in our private enterprise system many more times than not drives down prices and improves services. So this is what I would support specifically. I would support insurance reform that would not allow an insurance company to discriminate against a family because of a pre-existing condition. A small business in College Station 2 weeks ago. She's paying $1,800 a month. It's very close to what you're paying each month for your health care bills. I think we need to say to the insurance companies, your pool has to be bigger than one family or one company. I have a friend I know who desperately wanted to continue providing health care for his employees, but one employee had a catastrophic illness. And because that one employee's sickness that had nothing to do with anything in the workplace, nothing unsafe in the workplace, it was just a catastrophic illness, not the fault of the employer. The health insurance company said, we're going to drive up your rates dramatically for all the employees, and now that company had to drop health insurance for all of its employees. So people 2 weeks ago who were thrilled and happy with their insurance and the choice of doctors they had, now are realizing that they won't have health insurance in the months and years ahead. So we always say you can't discriminate against a small business because someone got sick. I want to say that there shouldn't be an annual and a lifetime cap on health insurance benefits. I met a coach in Somerville County 3 weeks ago who said, I'm about to seriously consider leaving the profession I love, teaching kids and helping kids, because my young daughter has a brain tumor. And thank God it's not malignant, but it is so serious it's caused my daughter to go blind. And he said, Chet, our problem is that we're about to reach our lifetime cap on our insurance benefits, and my daughter desperately needs additional care, so I may quit coaching and retire, cash in my retirement fund in order to see she gets the care she needs and deserves. I think we can, without wiping out the health insurance system, we can encourage the health insurance system to just work better, more effectively for small businesses and families. What do they get out of the bill proposed in the House? The insurance reform would encourage more people to go out and buy insurance, so there'd be a larger pool. So that would be the carrot for them. The stick for them would be you can no longer discriminate against people with pre-existing conditions or small businesses or someone like this coach whose daughter is facing very, very high health care costs. If we can do that, we can make the private health insurance system a better partner in our health care system. Thank you for sharing your family story.
I'm going to go to the bottom of the Up next, Stephen Schaefer from Cleburne to ask a question. After Stephen, Richard Jones from Granbury. Richard, where are you? Please stand up and get in an aisle. Mr. Schaefer, the floor is yours.
Congressman Edward, I'd like to thank you for coming tonight.
Thank you for being here.
You being the economics major, I'd like to address, I'm real concerned about the overspending the bills that we've had passed this past year. Like every time the government gets involved in something, their projections for what's going to be spent on it is way below where it even ends up being. In other words, knowing that, and some people are proposing to help, and I feel for the people that are unsure, but some people choose not to be insured. One of the proposals to pay for this is to charge, and I don't fall in that category, but to charge supposedly rich people higher taxes to pay for this bill. My question for you is, today we found out the unemployment rate is 9.7%. Do you believe, being an economics major, that it is a wise decision to raise taxes when the unemployment is going up? Do you believe that those people actually hire people? That's my question for you.
Say that I am grateful that the country in this audience is energized about addressing the issue of the deficits. I've been railing about deficits for the last 10 years. And one of the reasons I voted against the Medicare prescription drug bill several years ago is the then House leadership threw out the pay-as-you-go rule that allowed us, and I was proud to have been part of the bipartisan effort, it allowed us to take the largest deficits in American history in 1992 and turn them by the end of the decade into the largest surpluses in American history. We got rid of the pay-as-you-go rules over my objection and said you could both cut taxes and increase spending without paying for it. I think that was a major contributor to going 9 years ago from the largest surpluses in history to today the largest deficits in American history. So just 3 weeks ago in the House, about 4 weeks ago in the House, I offered the amendment to the new pay-as-you-go bill, where we no longer have pay-as-you-go as re-implemented as a rule of the House. I want it to be the law of the land. And that's going to put the discipline back. And I'm the one who wrote the amendment to say that shouldn't just be a temporary law for 4 years. It ought to be a permanent law. And it ought to be in place whether Republicans are in the majority in the Congress or Democrats in the majority. I voted for a lot of tax cuts in my 18 years in Congress. I voted for several $1 trillion of tax cuts, including earlier this year voting for an $800 tax cut for 95% of Americans. In terms of paid for this bill, would I want to raise taxes on people making over $350,000? You know, I wouldn't want to raise taxes on anyone, frankly. But I will say this, that it is terribly important that we put back in place the pay-as-you-go rule that was the rule of the House that did work in the 1990s and led to surpluses. So rather than doing what Congress did over my objection a few years ago and passing when Tom DeLay pushed through the prescription drug bill, it was about a $700 billion bill over 10 years, 70% of the estimated cost of this bill, and not one dime of that was paid for. I think if we're going to pass a bill, if we think it's good for the country, and again, I haven't decided to vote yes or no on this bill yet, but if we're going to pass a bill,